This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
We are bearing down on some 100-degree days coming into the weekend. So we'll go over a couple of the heat-related illnesses that we need to watch out for. Some of the more mild things, early presentations of people who have been exposed to heat cramps, people who are out in hot weather. This tends to come from an electrolyte disturbance. Usually you end up with low sodium, and you can end up with high potassium. Heat edema, we saw this a couple of times last week. People coming in with lower extremity edema with no reason to have accumulation otherwise. So no heart failure, liver failure, renal failure, but this new lower extremity edema. You can end up with heat rash, usually also on the lower extremities. Both of these are thought to be mediated by electrolytes. And then heat syncope is a more severe end of the spectrum for these kind of more mild causes. People who are either pre-syncopal or actually sync up in the heat, they still need to be removed from the hot environment, either given a Gatorade or a little bit of saline once they get here. Heat exposure is kind of getting into our more severe category. These people will actually come in with a high temperature, so usually above 38 degrees. Normally they're going to be below 40, but really as soon as you start seeing significant neurodeficits, they've progressed to heat stroke. It doesn't really matter how warm they are. If they've got neurodeficits, that's heat stroke. Typically for our boards, though, less than 40.5 degrees is going to put you in at risk for heat exposure. Those patients can end up nauseous. Usually they're tachycardic. They need to be removed from the hot environment and they need to be cooled quickly. And then our most severe type of heat-related illness is heat stroke. These are patients that come in altered, tend to have a neurodeficit, even if that's just altered. Heat exposure patients can be dizzy, but they shouldn't have any true ataxia. Once you have that hard neuro finding, you're more worried about heat stroke. These patients tend to have temperatures over 40.5. Again, it doesn't matter if grandma comes in with a temperature of 39. If she's got neurodeficits, she's still classified as heat stroke. There are two types of heat stroke. Your classic type is grandma who lives at home in an apartment and doesn't have AC. She tends to come in dry. She'll be tachycardic. And then her blood pressure can be either high or low. You may see us work up these patients for sepsis because tachycardia, high temperature. And a lot of times they're the only people living in the apartment, so they don't notice that they're starting to become more altered until either they call themselves or a neighbor comes over. And so you may not have that awesome story of this is definitely heat stroke, so you may see us start to go down the sepsis pathway. But it's important to note that if EMS is telling us that their environment is very warm, that the main thing you need to prioritize is cooling these patients down. The exertional type of heat stroke is something that you can think of this as the young patient on a football field doing 2-a-days in 100-degree heat. So these patients tend to come in wet. They tend to be sweating when they come in. They're still tachycardic. And again, they can have either high or low temperature. The advantage here is that a lot of times those patients do have other people around to give a good history for them. Hey, yeah, we were out on this really hot day. He started acting funny or kind of leaning to one side. They'll still have a neurodeficit, but you may have more history on those patients. This may be one of the few times that EMS actually stays and plays. So one advantage of being in an athletic field is that they tend to have access to an ice bath. And submersion cooling is actually the best way to cool people. And so it may be one of those times where we have a slightly delayed presentation and they may actually come in better than the way they were found if they have a chance to actually start cooling them. Otherwise, since we don't tend to have a way to submerge people here, we do convection cooling. That's where you'll see us kind of spray a patient down and put fans over the top of them. That's a really effective way of cooling them. In the meantime, while you're waiting to set those things up, you may see people do kind of other direct cooling measures like putting ice packs on them. Things that you're going to watch out for in heat exposure and heat stroke patients, these patients again are going to have electrolyte abnormalities. You can end up having rhabdo is something to watch out for, liver issues is something to watch out for, and then AKI. So a lot of these patients are going to end up with fluids. And then just kind of a bonus point, is Tylenol or any antipyretic helpful for these people? So no, these are all things that are based on exposure. Fevers and things like that are regulated by the hypothalamus. Those are responsive to antipyretics. Again, in grandma who is not able to give a great history, you may see us give those things. But again, it's just because until we have a total idea of what's going on, the picture may not be that clear.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.